portion of Utah's Morning News is brought to you by Regence Blue Cross Blue Shield.
And joining us live in studio is Dr. Mark Hiatt with Regence Blue Cross Blue Shield of Utah. Let's talk about our children's teeth. So what's the good news right now?
Mary, the good news is that their cavities seem to be less frequent. Over the past 5 years or so, the percentage of children with cavities, untreated cavities, has declined from about 50% to about 40%. That's good news.
I hear a lot of people, doctors, say, but it's just the kids' first set of teeth. They're going to lose them anyway, so who really cares, right?
Well, it really matters to get them started early with good brushing habits.
Yeah.
But also, during that time when they have those cavities, they're certainly going to be feeling discomfort and pain and sometimes even an infection.
Okay, so we got to get them filled, even if they're their baby teeth, it sounds like. Well, and then what can I do to make sure to prevent the cavities, to have good health for my kids' teeth?
Well, there's some certain simple steps that you can take. First of which is really to make sure your child has a dentist. And to see that dentist, usually it's recommended by age 1 to have that first checkup. And then at that checkup, you can talk to your dentist about special ways to protect your child's teeth, which include maybe discussion about fluoride in toothpaste, fluoride varnish, oral fluoride supplements, and even dental sealants.
Okay, interesting.
Yeah.
Hey, let's move on to this other topic. We're talking about night owls now. Now, I am no night owl, may I say, because I go to bed at ridiculously early times so that I can, Mary, you know this too, so we can do this crazy shift.
Yeah.
But if the early bird catches the worm, then what's the night owl more likely to catch, Doctor?
Brian, unfortunately, the late owl is more likely to catch diabetes, psychological problems, and even an increased risk of mortality, according to a new study.
Oh, wow. Well, so what should they do? Those that just like to stay up later?
Well, you could certainly try to adjust your schedule, but these findings really show that night owls need to take this as a wake-up call. That is, they need to be more concerned about and more vigilant about maintaining a healthy lifestyle, which includes eating right, exercising, and most importantly, getting enough sleep.
And I know that this study you were talking about tracked 500,000 adults for about 7 years. Talk more about what that study found.
Yeah, it was done with adults in the United Kingdom, about 500,000 over the course of 7 years. And it determined that at the end of the study that these people who identified themselves as night owls.
So just stayed up really late.
Right.
Yeah.
Had this increased mortality risk.
Wow.
Increased by about 10% compared to those who identified themselves as morning people.
And it goes back to, like you said, getting better sleep, exercise, and eating healthy. There's no magic pill. We've got to do those things.
Right.
Of course.
There you go. Doctor, always great to see you. Thanks so much for coming. And this portion of Utah's Morning News is brought to you by Regence Blue Cross Blue Shield. KSL News Time, now 8:49. Another check of Triple Team Traffic is brought to you by Mountain America's Quick and Easy Home Loans. And that starts with you, Andy.
Well, it was starting to improve on I-15 down in the Draper area, but boy, it's suddenly gotten worse in the last little bit, both trying to get on I-15 at Van Getter Highway, and once you actually do manage to get onto the freeway, the main flow, very slow going.